Hello, I'm Dr. Paul Fisher with Innovative Nerve and Joint Centers, and today we're diving into a topic that can empower you to take control of your health. The 10 questions you should ask your doctor about neuropathy. Before we do, grab my free guide, 5 things you can do to help your neuropathy by the link below, or book a consult with us if you're looking for a non-invasive, drug-free approach to neuropathy relief. We see so many patients in our clinic who feel lost or unsure about their nerve issues, and asking the right questions can make all the difference. Make sure to watch to question 10. That may be the most important one you can ask. We've seen patients who've been to podiatrists, primary care providers, neurologists, physical therapists, and still aren't aware of one of the biggest concerns with neuropathy. We'll make sure you ask the right questions if you're dealing with tingling, numbness, or unexplained pain. This video is for you. Over the next 10 minutes, we'll walk you through these essential questions, explain why they matter, and share practical steps to get the answers you need. Stay with us. This could be a game changer for you or someone you care about. If you or a loved one has been diagnosed with neuropathy, make sure you know what questions to ask. Before we dive in, some lawyer talk. Please consult a healthcare professional for any issues you may have. This is not personal healthcare advice and is for informational purposes only. First, let's set the stage on why these questions are so important. Peripheral neuropathy happens when the nerves outside your brain and spinal cord, your peripheral nervous system, get damaged. These nerves are like your body's wiring, carrying signals for sensation, movement, and autonomic functions like digestion or sweating. When they're compromised, it's like static on a phone line, causing symptoms like tingling, numbness, or pain. Common causes include diabetes, vitamin deficiencies like B12, infections, autoimmune conditions, or injury. Too often, patients leave doctor visits with more questions than answers, and we've seen this lead to delayed care. To be upfront, not every neuropathy case fits the textbook, but asking these questions can clarify your diagnosis and treatment. Let's start with question 1. What's causing my neuropathy? This is the foundation of your care. Neuropathy can stem from diabetes, B12 deficiency, chemotherapy, or even repetitive strain, and pinpointing the cause guides treatment. Write down your symptoms in a journal, when they started, what makes them worse, and ask your doctor for tests like blood work or a pseudoscan, which we use in our clinic to measure nerve damage. Also, make sure you don't have a sciatic issue as opposed to peripheral neuropathy. These issues can be confused and even overlap. When the two are present, we find treating both gets the best results. Find my video about this linked below. Knowing the cause or causes helps you address them directly to get the best results. Question number 2, how severe is my nerve damage? Not all neuropathy is equal, and severity affects your treatment plan. We use pseudoscan technology to assess nerve damage precisely, and it's eye-opening. One patient had mild tingling but significant damage on pseudoscan, so we tailored an aggressive, non-invasive plan. Another had severe pain but minimal damage. They improved quickly. Ask for tests like nerve conduction studies or pseudoscan to gauge severity. Track your symptoms intensity to help your doctor interpret results and plan next steps. Question number 3, are my symptoms typical for neuropathy? Neuropathy varies widely. Some feel burning, others numbness, some balance issues. Asking this ensures your symptoms align with neuropathy, or if they point to something else. Make sure to ask what other issues could be causing these symptoms. Bring a notebook or a friend to your appointment and take notes. It's amazing how much information you will be going through. There will be a lot of information there, and you'll be amazed what you may forget. This will help you stay on top of your health. Question number 4, what test do I need to confirm my diagnosis? A proper diagnosis requires more than just a symptom check. Tests like blood work for B12 or diabetes, nerve conduction studies, or imaging can pinpoint the issue. That notebook will come in handy here as well. Question number 5, can lifestyle changes help manage my neuropathy? This is key because lifestyle can make a big difference. Diet, exercise, or blood sugar control can slow progression. One patient in our clinic reduced her symptoms by changing her diet, performing targeted exercises along with our care. Ask your doctor about specific changes like avoiding alcohol or wearing supportive shoes. Keep a log of what worsens or improves your symptoms to tailor your lifestyle plan. Question number 6. Are there non-invasive treatments for my neuropathy? Medications aren't the only option, and many patients want alternatives. At our clinic, we use drug-free therapies like Class 4 medical cold laser, neurobiofeedback, and shockwave therapy. Dawn, whose testimonial is linked below, cut her foot pain with our treatments and got back to walking. Ask your doctor about non-invasive options and if they're right for you. Track treatment responses in a journal to see what works. Question number 7. How can I prevent my neuropathy from getting worse? Early action can slow or even stop progression. Controlling diabetes, addressing deficiencies, or avoiding nerve irritants like tight shoes are key. We had a patient prevent worsening by starting our nutrition program early based on our pseudoscan results. Ask your doctor for specific prevention strategies like diet or exercise plans and monitor your symptoms to catch changes earlier. If your doctor says there's nothing can be done, maybe time to look for another one. Question number 8. Could my medication or other conditions be contributing? Some drugs like chemotherapy or conditions like autoimmune disorders can trigger neuropathy. We had a patient whose tingling started after a new medication. He was actually just in here yesterday and had been doing really well, and then we noticed a slight progression. Found out that the new medication he was on, that was one of the side effects, was increased tingling in the fingers and toes. List all your medications and health conditions in your journal before your visit. Ask your doctor if any could be contributing and if changes are possible to reduce nerve stress. I've linked a study below which goes through multiple classes of drugs that have been known and shown to cause neuropathy. Question number 9. What are the risks if I don't treat my neuropathy? This question is critical because neuropathy can worsen, leading to chronic pain, mobility loss, or complications like foot ulcers. One patient ignored numbness and developed an infection requiring urgent care. Ask your doctor about your specific risks, especially if you have diabetes and what untreated neuropathy could mean. For more on urgent signs, watch our video, Why Neuropathy Symptoms Worsen at Night. You guessed it, link below. Stay proactive with daily skin checks and symptom tracking. And finally, question 10, perhaps the most important one of all. How's my balance compared to a person my age without neuropathy? This is a vital one and one many patients don't ask. And even more concerning, most doctors in our experience don't address it either. Stumbles, trips, and other balance issues are a warning sign that something severe is wrong. While many people are concerned about the risk of an amputation from neuropathy, a fall can be even worse. One of the earliest signs of balance issues that we see is problems in the shower, especially when washing your hair. There you have it, the 10 questions you should ask your doctor about neuropathy, from causes to follow-ups. These questions can clarify your diagnosis, guide treatment, and empower you to take charge. If you're noticing symptoms like tingling or numbness, don't wait. Start a symptom journal and call a healthcare provider or neurologist for a full evaluation. Tests like pseudoscan or nerve conduction studies can uncover the cause and set you on the right path. At Innovative Nerve and Joint Centers, we've helped countless patients manage neuropathy with drug-free, non-invasive approaches like laser therapy, neurobiofeedback, shockwave therapy. Early action is key. For more health insights, subscribe to our channel and share this video with someone who needs it. If you're ready to ask these questions or want help with your neuropathy, share your story below or contact us to see if we can help. Start taking steps today to be able to take steps tomorrow.